The study club at the Complete Implantology Clinic in Maidstone teaches dentists how to manage the restoration of simple implant cases, such as crowns, small bridges and simple overdentures, and provides training in the basic techniques required for restoration work.
Now, 9 times out of 10, if something isn't fitting down nicely, it's the contact point, because implants just don't have any flexibility in them. So if you can't fit it down and it seems to be as if it's not fitting at all down, don't panic, you've got an impression issue. It often is just the contact point.
Whilst some of the surgery is specialised, many of the restorative aspects can be done by a patient's own practitioner.
We as surgical specialists provide the treatment planning and the surgical stages of the treatment, and we mentor and train dentists in how to follow through and provide the restorative aspect of the implant care on their own patients that they've referred to us for team joint management.
It means that the patient can be treated in an environment they know and are comfortable in, and is professionally rewarding for the dental practitioner.
We can be quite isolated as dentists, even if we work as part of a team. We tend to be the only dentist in the surgery. There's a lot of new materials, a lot of new techniques. It's tricky to keep up to date and have credible knowledge about those things. If we're being presented things by a company, for example, they're obviously going to be somewhat biased towards their own products. So it's nice to have somebody that's got a wealth of experience and sort of clear away some of the murkiness.
The good thing of coming to a session like this is you meet your other colleagues, it allows you to network. The big advantage of the study club is that a lot of my patients, if I said about having implants done, they would actually say, well, we don't want to do it because you don't do it. So the advantage of this study club, and obviously being involved with Ben, is that it allows us to say to the patients, we've got somebody who will place the implants and then we will do the restoration for you.
It gives me the opportunity to bring along cases that I can discuss with Ben. Any cases that are particularly difficult, Ben is my mentor so that I can do them under his guidance. And it's just a general learning atmosphere with other colleagues that are also into that aspect of dentistry.
The study club sessions aim to remove some of the mystique from implant dentistry.
So it's interesting, people think you have to have 4 implants to do a bar overdenture and that 2 implants is for these removable attachments. Go to 3, you get tripodization, complete rigidity. You don't have to go to the expense and complication of a bar. Very simple treatment and 100% effective. It's a very good treatment.
The idea is not to train people in advanced surgical techniques, but to help dentists become part of an extended team. The specialists at the Complete Implantology Clinic provide the surgery, and the referring dentists undertake the restorative work in their own practices.
If someone's got the ability to be a good all-round general dental practitioner, they've got the skills already there to be able to provide the basic, simple implant restorative care. All we need to do is bring that skill out in them, give them some confidence and appropriate training.
Afterwards, the Complete Implantology Clinic continues to provide a mentoring service, and dentists are encouraged to spend time at the clinic and see other patients being treated.
There's a lot you can learn from these study clubs. It's well and good we do implants, I do routinely implants, but when you come to meet someone like Ben, who's obviously had a lot longer experience, you tend to pick up those tricks, those little secrets that you don't normally read in textbooks, and this is invaluable in terms of putting it back into your practice, and it could save you a lot of trouble.
Chance to discuss cases with colleagues, bounce opinions, learn techniques about implantology, which we don't do within our practice, so it removes some of the mystique and things from it, and it gives you a point of contact, a face to the person you're referring to, and he's quite approachable and you can phone him up and ask him if there's any issues and discuss referral cases rather than just exchanging letters.
You've got to learn somehow, and having lots of people together, all looking over various cases or individual cases, you know, yeah, I mean, first time around, I mean, I think great, I'd want to come again.